This is Bruce Lane, AANA State Government Affairs staff, and I wanted to give you some updates from the state healthcare policy perspective of things we're seeing at this time during the current crisis. Obviously, we're going through some very unprecedented times in every aspect of our lives. For anyone whose profession is licensed and regulated by the state, such as CRNAs, the chaos that's affecting state governments is going to be reflected in how you're able to do your jobs. Since states are scrambling to adjust to deal with the healthcare crisis, state laws relating to healthcare professionals are changing dramatically from week to week. And what we've had 6 weeks ago is very different than the situation we see today. Since the situation is constantly evolving, many of these changes may end up being temporary, but for right now, they can still have a very significant impact on how you're able to do your job at this time. It's been a challenge for us, your ANA staff, to monitor the changes that are taking place. Many state governors are putting out multiple executive orders per day, and each one of those executive orders might deal with a half a dozen unrelated topics. When you're tracking this for all 50 states, this is a lot of information for us to try to stay on top. Additionally, many governors are just using press conferences to make policies. They'll stand at a podium and just announce some change without issuing any formal document. It makes it very difficult for us to monitor what's going on then. And that's just the executive orders. Many state agencies, like a Board of Health or Board of Nursing, they're issuing emergency rules on a regular basis. And while many state legislatures have suspended their activity, there's others that are still going strong and putting out large amounts of new legislation. So for us to monitor what's happening and how that's going to affect your job it's very tricky. But one of the main purposes for ANA State Government Affairs and for your state associations is lobbying. We're not just trying to figure out what changes are happening and report that back to you. We want to be able to put changes into the law that are going to be best for you and the patients you care for. It's not just enough to know what's happening. We want to create positive improvements for you. So normally, when a state wants to change a law, you'll see an initial proposal published. For a legislature, that would mean a bill gets introduced. For a board, that'd be a rule proposal. And when that happens, there's going to be a period of time before the item gets voted on and before it gets enacted. During that time, we'll have a chance to comment. We can talk to the lawmakers. We can say, we like this, we don't like that. You can hopefully amend these things. If it's an item we like, we can talk to lawmakers and encourage them to vote for it. If it's not, we can encourage them to vote against it. In the current climate, though, executive orders and emergency orders are just coming out and immediately becoming law. So we just don't have an opportunity to comment on them and be persuasive. This makes lobbying on issues very difficult, obviously. But we are changing our tack from what we normally do. What we're doing at this point is we find that we're having to talk to governors and policymakers before these orders come out, try to be persuasive about what we're concerned about and what we hope to see in these rules in the hopes that they make their best positions, make them very favorable to CRNAs and the CRNA community and again, your patients. But it's a very tricky business for us at best. Despite this, we have seen some very positive actions during this time. States are doing a lot of things that we think are very good. How they are using CRNAs right now, and it varies from state to state, but we think there's a lot of positive steps that we've seen in terms of how states are addressing this. Some states have removed supervision requirement. Some states have expanded CRNA scope of practice. We've also seen things states are doing that aren't necessarily directly CRNA related, but we still think they have a positive impact. So for example, enabling more telemedicine options or allowing healthcare providers to practice across state lines. These are all positive steps that we think is making a better environment for you as CRNAs to work in, at least in the short run. It does vary greatly from state to state, but overall the picture has been positive in terms of what states are doing. And we really consider it a good thing that states have recognized that when there's an acute healthcare crisis, they see CRNAs as part of the solution. They are allowing you to step up because they recognize that you have an important role to play in solving this healthcare problem. Your state associations and AANA staff have been working it hard to help enable these changes, and we want to continue to work with state policymakers to see what additional changes we can put forth. So what does this mean for you then? Well, ANA has developed a lot of COVID-related resources. If you've been on our web pages, they're full of things to try to help you deal with this crisis. But we do have one page that's specific to state government resources. So if you go onto the ANA page, you click on the Advocacy and Policy tab on the ANA webpage, and then click on State Government Affairs. There'll be a link right at the top that says information on state actions related to the COVID-19 situation. If you click on that, that brings up a page that has a list of state-by-state actions of what we've seen that we think are most relevant to CRNA practice. And like I said, it's hard for us to practice, so we're trying to do our best to find things to put on there. I can't guarantee it's 100% perfect, but the things that we think are most relevant to your practice that your state has done, we've put on that page. But more importantly, it also contains advocacy resources. Talking points in a sample letter for contacting governors, for example. But also we have talking points and communications for facility administrators. And this has been an issue that we've seen. Even if the state removes requirements or expands your scope of practice or removes a supervision requirement, it doesn't count for much unless a hospital lets you do those things. So you have to be able to talk to your administrators and get those changes put in place at that level. So we have developed resources for that as well. There are other resources out there you might want to be aware of that aren't necessarily ours, but I still think are very good resources that could help you at this time. The National Governors Association has a very good webpage that has a list of every single action every governor has taken during this crisis. It's very thorough. It's a lot of stuff that won't be relevant to you, but if you want to see what your state is doing, if you want to parse through that to see what you think might be most relevant to you, that is a good resource. So that's the NGA, National Governors Association webpage. The National Council of State Legislatures has also put together a very good page because theirs is more legislative oriented. They're doing a list of bills that are being introduced and are being enacted that deal with the COVID crisis. And again, if you want to look through that to see what your state is doing, and it's going to vary from state to state very much with the legislative part because not all state legislatures are even in session. A lot of them have gone into recess, but there are still quite a few that are putting bills out there. So the NCSL page is another good resource for that as well. Again, search for NGA or NCSL and these pages should come up pretty easily. Our goals with state government is always to keep informed about what's going on in the world and to advocate in your behalf. And the page we've created represents really the tip of the iceberg of the work we're doing and the work your state associations is doing. But we hope it gives you the information you need at this difficult time.